Dr. Kevin Sabet is the head of Smart Approaches to Marijuana, SAM, and he joins me today. Hi, Kevin.
Hi, how are you, Aaron?
I'm doing well, and we're very grateful for your help today to continue to better understand what is a very complex set of issues, because it seems that we're having multiple conversations at once.
Yeah.
Conversations around whether people should be locked up for smoking a joint. There's conversations about the benefits of marijuana as a medical product. And there's conversations about a commercialized market. Of those issues, is one of them more important than the others?
Yeah, I mean, look, they're all important issues, but I think commercial marijuana legalization is very important. It's the most important because it's about creating a massive new industry that basically relies on addiction for profit. So if you look at any other addictive industry, they rely on the really 10% of its users pay for 80% of the revenues for that business, like alcohol or tobacco, for example. And what that means is that these businesses rely on hooking people, and they don't want casual users. They don't want the one-off user. They want regular users. And I'm worried that we're creating basically another tobacco industry right under our nose. It doesn't make much sense to me to be, basically closing the door on tobacco and talking about all the harms while at the same time rolling the red carpet out for cannabis.
Well, we've chosen to be an evidence-based campaign, but to be honest, that has meant that a lot of people have often accused us of fake news, which is of course, the easy thing to say anytime you disagree in our current environment. However, I can see why some people are confused. I have seen from the same jurisdictions studies that say there's been a minimal increase in use post-legalization, and other studies from that same country saying there's been a significant increase in use.
Right.
How do we work out who to believe?
It's hard because there's a huge propaganda machine pushing the normalization of today's very high potent marijuana. And so it is hard to know that. We rely on science. We rely on scientists themselves. We have a blue ribbon scientific advisory committee from Harvard and Yale and other top research institutions in the United States that guide everything that we do and everything that any of our affiliates do around the world or around the US. So for us, the science is most important. And it's true. Most people don't realize that today's marijuana is much more potent than it used to be. And that it's causing a lot more problems than it ever did. A lot of people's experience with marijuana or cannabis is basically kind of, they tried it, they didn't really like it, they moved on with their life. It wasn't a big deal. It's like, someone who was speeding on a highway. They did it once, they didn't get into a car crash, so what's the problem, right? Everyone can do it. Well, the reality is when you speed, you increase your risk of a car crash. And the same thing with marijuana. When you use it, you increase your risk of these problems, especially if you use it before you're age 25. And so I just worry that they were creating another very hungry industry, and they are obscuring the statistics. They are obscuring the facts. Listen, we're never saying that marijuana is a demon drug and that its users should be locked up in prison and throw away the key and forget about it. This is the worst drug ever. No, it's not the worst drug ever, and we wouldn't want to do that to anybody. However, it's much worse than people realize. And again, what we're talking about today is not what we were talking about 20 or 30 years ago.
Well, let's address a couple of those things that I've heard, particularly from users. Two claims. One is that it's not addictive. People will look me in the face and say, I just don't believe it's addictive. And the other one that goes alongside of that is, I've never heard of anybody ODing from cannabis, so therefore it's nowhere near as dangerous as other things. What would you say to that?
Well, nobody ODs from tobacco either, from cigarettes. It's an extremely rare event. And so the idea that we're just concerned about ODs, to me, that doesn't make sense because nobody's dying from an overdose of smoking too many cigarettes, right? But we know it's a huge public health menace. Why are smoking, cigarettes, and alcohol the biggest public health menaces to society? Why is that? Well, it's not because they're more harmful than heroin. It's not because they're more harmful than methamphetamine. It's because they're actually used far greater than are illegal drugs. And they're used far greater because they're legal. They're normalized, they're legal, they're available. And that's what goes into the harmfulness of the drug. It's not just the individual sort of biology of a substance. If that were the case, we wouldn't have as many deaths or costs to society from our legal drugs, but we do precisely because they are legal and available.
Talk to me about where laws go, because, for example, at the moment, if we bring up edibles in the debate, our current proposed law says that edibles won't be available from shops, and yet we can see that they're freely available, or not so free, but certainly widely available in the black market. Do laws change over time? Is something that's restricted today potentially become available tomorrow?
Yeah, they do. Listen, if we could freeze the New Zealand law, throughout history, we might say, well, it's better than Canada and it's better than the U.S. It's reasonable. You all are pretty reasonable people we hear up here. So, you came up with a reasonable law. Okay, we don't love it, but we can live with it. The reality is over time, because of the pressure groups, because of the money that's into this, and frankly, because the government says, well, the sky hasn't fallen, so let's expand it a little bit. And of course, the reality is consequences for marijuana are often felt 10 years down the road, 15 years down the road. Again, it's not like methamphetamine where it's always instant. Now, in some ways, it is instant with driving, which we can talk about, or psychotic breaks, which we can talk about. But in many cases, this is something a lot of parents call it a slow kill. Their child didn't die from meth or heroin overnight, but they had a slow kill over time. And so a lot of governments in the short term might, to gain some political points and say, hey, we're going to bring in more revenue and be more open, et cetera, that they're very likely to actually loosen the laws. And we're seeing that in many U.S. states where something starts out very restrictive and then it gets very loose over time. We've seen that in Canada where they outlawed edibles and then they said, well, a year later, we're going to allow edibles on a certain date. And now they do have edibles. So, and listen, Canadians are pretty sensible people too, but yet they are allowing that. So, I think it's easy, especially as someone who's, I'm married to someone who's not American. I lived abroad a lot of my life. I think it's very easy to say, oh, well, those are, we're never going to do it like those crazy Americans. They're capitalism central, which is true. I mean, America is, and we tend to do a lot of the things in a very extreme, unhealthy way for the mighty dollar, right? But it's easy to sort of say, well, we're not going to do that. Don't worry. It's not like that. We're not going to be like Colorado, where we're going to have gummies and candies and teddy bears and lollies and ice creams. We're not going to be like Washington, where we have 99% dabbed concentrates advertised on billboards and with coupons available to anyone essentially with a pulse who's over 21. We're not going to be like those crazy folks. We're going to do things in a very proper way, in a regulated way. The problem is, again, things easily open up because of money and politics over time.
Regulation sounds like a good idea, this idea of creating this safe place to buy safe products. The challenge, of course, is that the black market are simply not going to surrender their income so easily. Like, I have young adult children, and my son showed me just the other night. He said, Dad, look at the messages I get through social media from people I went to high school with who are offering to sell me drugs. Look at the Snapchat picture of a table full of little bags of marijuana that are available for sale that will appear on his social media stream and disappear just as quickly. And he joked to me, he said, Dad, this young man who's trying to sell me has a marketing degree. He is absolutely engaging the skills he got from university to try and sell drugs on the side. The black market is changing, and it's different from what we perhaps were expecting.
It is. Listen, the underground market dealers don't, go to dental school once you legalize drugs, okay? These people adapt. They're able to say, oh, you're selling it to these people for this much? Well, then I'm going to sell it to the younger people for that much. Or you only sell it at certain times because you have nice, beautiful regulations around it. Well, we don't care about those regulations. We're going to keep doing this. So listen, the black market hasn't been eliminated or even significantly reduced in any U.S. state that I've seen, or Canada. I mean, there's a thriving black market in Canada, especially for marijuana and even for cigarettes, because they raised the price on it. So there's a very large black market for cigarettes as well, both in the U.S., but especially Canada. And so the idea is that the drug dealers aren't going to go away just when you legalize and regulate. And by the way, this idea of, well, at least we can get a safe substance. There aren't the reasons why people are going to the hospital today in New Zealand for cannabis. It's not because they're having laced cannabis. It's not because the dealers are lacing it with something. Marijuana is cheap enough. They're not lacing it with anything. They are. It's because of the harmfulness of marijuana. It's because of the potency and the fact that people are ingesting things that are much higher than they used to be. And I know that New Zealand is trying to put a cap on the potency. First of all, the cap is very high. I mean, 50, if you're a naive user, especially, unless you're a regular user, 14, 15% THC is very high, number one. Number two, that's a perfect invitation to a black market dealer to say, I'm going to sell 20%, 25, 30, 50, 90, and get away with it. So you cannot regulate marijuana. This is the problem. It cannot be regulated properly. Whenever you try and do something, something else will pop up. It doesn't mean we have to throw people in prison. It doesn't mean we have to, give up on folks. We should not do that. But we also shouldn't be normalizing and promoting something we know is harmful.
Well, let's talk about this kind of false choice that appears to exist. This idea, on the one hand, we either throw people in jail,
right.
We have a legal market, and we promote health and
right.
education. But I notice on our TV screens, there are campaigns trying to target things like speeding and drink driving. These are still illegal, and yet we do have health and education campaigns for things that are still illegal. Is that a false choice?
It is a false choice. Listen, we don't need to lock people up or legalize and normalize. We can educate, have prevention, treatment, get people help who need them. I think it's often set up as this boogeyman of prohibition. If you don't do this, then we're going to have everybody come and lock you up in prison, if you come and smoke a joint anywhere. That's not the reality. And so the reality is we can do better, have better laws rather than these two. I would say both are extremes. On the one hand, heavy-handed enforcement and all the problems that brings and not giving someone a second chance or giving them treatment. But on the other hand, the extreme of essentially mass normalization and commercialization.
We'll talk to the person who says something like, hey, look, what I do in my home is my business. I'm not hurting anybody else. If I want to smoke a joint, if I want to use cannabis, it's not hurting anybody.
Yeah. Well, even if we take that at face value, so if we take the fact that they don't have a family, they're not getting in a car, they're not late for work, they're not having a strain on the healthcare system, let's just take all that for granted and say they really are somewhere out in the woods and they're smoking a joint and falling asleep on a Friday night. They're hurting nobody. This referenda has nothing to do with them. I mean, it's not about allowing people to sort of smoke a joint in the privacy of their own home. If that was the case, the wording of what you all will be voting on would be very different. And so the reality is this is about commercialization. This is about profits. This is about folks thinking that they can get some revenue from it, tax revenue, even though the revenue is always a drop in the bucket. It's never what you think it's going to be. And so, again, it's not really about that individual person, sort of libertarian argument at all.
I want to talk about one of the obvious sort of social outcomes where use kind of affects me, a member of the public, and that is when you get behind the wheel of a car. And there are two issues that I really want to understand a bit better. On the one hand, that it seems the police are saying there's no accurate roadside impairment test. They can't get you to blow into the breathalyzer and work out how high you are. And again, we have lots of users who are saying to me, I feel like I'm a better driver when I've had a smoke.
Yeah.
The worst one.
Yeah, I've heard that a lot. I mean, the reality is the research shows about a twofold increase, so a doubling in the risk of a car crash if you have even a small amount of THC in your system. It's not a huge amount. So we are seeing that. And there is no way to test impairment because marijuana affects people very differently from person to person. So it's very hard to have a cutoff number like we do for alcohol. Also, alcohol is absorbed quickly through your body within 24 hours, whereas THC, which is the active ingredient in marijuana, that absorbs, that can take much longer. It's absorbing in your fat, it's lipid. So it can be a week, it can be less, but it's never going to be 24 hours usually like alcohol is. And so it affects people very differently. The concentration of THC in your system doesn't necessarily correspond with how bad you're driving, and because everyone is different and naive users are different than heavy users. And there are all these considerations that come into play. So we don't have a way to accurately predict impairment right now. We might one day, but why would we legalize something that we don't even have the technology to protect people who are innocent non-users? The other way that we have to protect non-users, I think, is from the secondhand smoke issue. It's taken basically Western civilization about 100 years or more of pain and suffering at the hands of massive tobacco companies that sold what they wanted to, when they wanted to. In fact, I had a friend give me something. He found something in a magazine that was, it was actually a magazine that also funded the marijuana movement in the 80s. And it was, I have to show you this right here. It's the Camel cigarette right here. And it's about, you get your free Camel t-shirt. This is from 1988. So it's, it's not yesterday, but it's also not ancient history. We learned the hard way, it's in terms of what these companies did and why we would want to repeat that. To me, it doesn't make absolutely any sense. And so I worry about the secondhand smoke of non-users. I worry about that environmental smoke. I worry about inhaling it through apartment buildings. That's become a very big issue in the United States, is smelling marijuana, because marijuana smoke is pungent and it travels far and fast. And it's different, actually, than cigarette smoke in some ways. And so I worry about that because of the effects on your lung and heart. And so there are plenty of things that I think affect people who don't use it that get affected by multiple and more and more people using it.
So imagine we're sitting together in an airport lounge and the call for your flight suddenly comes over the loudspeaker system, and the person turns to you and says, "Kevin, it's been interesting to meet you. I've got to go, but tell me one thing that I need to know to make my decision on this referendum." What's the one thing they need to know?
One thing they need to know is that marijuana is not as harmless as it's portrayed, and that we should not be normalizing a substance that basically the barons of pot, the ganjapreneurs, are waiting to pounce on a new market. And you have to decide whether or not our kids and our children's future is worth that or not. That's a decision everyone's going to have to make.
So it's to Ireland we go to say a very warm hello to Dr. Mary Cannon.
Hello, Aaron.
Well, it's great to have you with us, Mary. Let's talk a little bit about your connection to this topic. Your expertise is around psychosis, around particularly in children. Tell us about your interest, your experience with this topic.
Well, interestingly, Aaron, my experience starts in this topic starts in New Zealand, because I was working in London with Professor Robin Murray, and he suggested that myself and a researcher called Louise Arsenault would look at the Dunedin cohort, because Temi Moffat and Avshalom Caspi had just come to work who are the co-directors, had just come to work in London. And so myself and Louise, along with Richie Poulton and Robin Murray and Temi and Avshalom, decided to look at the issue of cannabis and psychosis, because a very interesting study had come out from Sweden several years earlier, showing that the young conscripts who at the age of 18 had smoked high levels of cannabis had a 6-fold increased risk of psychotic disorder later in life. And I mean, myself and Robin, we were interested in risk factors for schizophrenia. And this seemed like a really powerful risk factor to look for. But I suppose the issue was, had these people been showing signs of psychosis before? And the Dunedin study was really interesting in that they had information on psychotic experiences from age 11, and then cannabis use at 15 and 18, and then they followed the young people up to age 26. So that was my start in this. Now, I've never been to New Zealand. I would love to go, but I was working on this New Zealand data.
Well, perhaps when the borders finally open, we'll make you one of our first guests. Let's talk about even the studies you've referenced there, relatively old data back when the THC level in cannabis was comparatively low than to what it is today. How much worse are the problems now that the THC content in cannabis is that much higher?
Well, yes, it's really interesting, because we didn't consider the issue of potency or strength of cannabis back then. It was just cannabis. It was just, as you say, weed. It was just what people smoked, and there didn't seem to be a big variety. But when we looked at the study, we found that young people who started smoking cannabis at age 15, by age 15, had they had 4 times increased risk of having a psychotic disorder. Like, this is a diagnosis of a psychotic illness such as schizophrenia or schizophrenic disorder at age 26. Now, and then Louise and I did another analysis looking at using the results of all the studies that have been published to date, there were a handful of studies at that time showing this link between cannabis and psychotic disorder, and showing that if you eliminated cannabis from, you can do a kind of a scientific trick, if you like, or a mind. It's this formula. So you can feed in how much psychotic disorder would you have eliminated if you could have eliminated cannabis as a risk, from the population. And we show that about 12 to 13% of cannabis of psychosis could be eliminated if there was no cannabis. Now, recently, studies have been coming out from Europe, and there's a large study called the European Gene Environment Interaction Study, and Marta Di Forti has been looking at this issue, and now she is finding with she's divided up into high potency and low potency cannabis. She's finding with the high potency cannabis, you're talking about risks, 5-fold increased risk. And also for those with daily use and high potency cannabis, there's a 9-fold increased risk of schizophrenia and other psychotic disorders. So this is clinically diagnosed psychotic disorder. So the risks do seem to have gone up. And the other very worrying thing is when they did the same kind of analysis, this population attributable fraction, they show that in certain parts of Europe, such as London or Amsterdam, that cannabis appears to be accounting for 30 to 50% of all psychotic disorder in those areas. So they're definitely, the effect is getting stronger. Like we could pick it up even back then with, as you say, the Woodstock weed, but it's definitely stronger now.
One of the interesting findings from this Kiwi longitudinal study was a drop in IQ among young people who were chronic users. How does smoking cannabis make you lose IQ points?
That's a really good question, Aaron, and we don't really know enough about how cannabis is affecting the brain. It's such a complicated substance, and there's so many of these endocannabinoid receptors all over the brain. We don't really know how it's doing it, but all we know is there's increasing evidence now that it is doing it, that cannabis can be very damaging to the young developing brain. And in fact, you talk about the Kiwi study, there are 2 studies, in fact, in New Zealand. New Zealand has 2 excellent longitudinal studies which have been studying young people since the 1970s. One is the Dunedin study that I mentioned, which is based in the University of Otago. The other is the Christchurch study, which was led, and they both study about 1,000 young people who were born in the 70s, following them up over time. Now, the Dunedin study did show, as you say, a startling up to 6-point decrease in IQ, and in certain cases for the very heavy users, up to 8-point decrease in IQ over the lifetime for those who are using cannabis heavy from an early age. The Christchurch study, and a very interesting study by Ferguson and Bowden was published looking at the general outcomes. Now, not just IQ measures, but I suppose IQ by itself isn't that important if it doesn't affect your life. But what they showed in the Christchurch study was that young people who used cannabis between 14 and 25, an increased use, showed a drop in increased rates of dropping out of college. They showed increased rates of them being on social welfare later in life, of poor just general socioeconomic class drop later in life, poorer finances, and general decrease in life satisfaction. So it's not good for your brain, and it's not good for your prospects in life, particularly for young people. There's something that the developing brain is particularly susceptible to cannabis, particularly the high potency cannabis.
I had a mother come up to me recently in a meeting, very forlorn about her now young adult's son's cannabis use that started in his teenage years. And her question to me, which I really wasn't sure of the answer, was, can these effects be undone? Is there any hope for these young people once they've damaged their brains?
That's a very good question. I mean, there's always hope, but you have to stop using it, particularly in psychosis in my area. The rate of relapse of psychosis, once you've been diagnosed, you may or may not relapse later in life. And the rate of relapse is very dependent on whether you keep using cannabis or not. And of course, the longer a psychotic disorder goes on, the worse the effects on your life. Now, initially, it used to, a certain amount of the what we call cognitive impairment related to cannabis, the memory impairment, concentration, and problem-solving problems, they can be reversed if you stop using cannabis, a certain amount. Now, for chronic, heavy, early onset use, it seems there are some persisting impairments, and this is very worrying. Now, they may not be. We've seen up to 8-fold risk in the Dunedin study. I've been working on some data recently, and we're showing that approximately we're finding like a 2-point decrease in IQ. So a certain amount of it can be reversed, but some of it can't. And depending on, as you say, the when you start using and how long you keep using.
Well, when seems to be a really important issue, in that it seems that there's this critical period during brain development in the teenage years where cannabis has a much more severe effect than perhaps for those who start using when they're older. Why is that? What's so special about the teenage brain?
Well, the brain is going through all kinds of changes throughout adolescence, right up to the age of 25. I suppose we're very focused on adolescence, but the brain doesn't stop developing to age 25. And I'm actually an adult psychiatrist. I'm particularly concerned with the 18 to 25 age group because they are also at risk. So the prefrontal area of the brain is the last to develop, and that's the area that controls judgment, if you like, and problem solving. And the ability to control your impulses. So this particular area, you need to be, I suppose, if you're affecting it and damaging it in some way with a substance, this is going to have effects on those areas of your life which are very important for when you go into adulthood. But what we found, just to get back to your point, the link with psychosis we found in the Dunedin study was particularly pronounced in those who started by age 15. But we also found, which is interesting, and we didn't make too much fuss about it at the time, but the link with depression was actually stronger for those who started later in life. So you're not immune even if you start, later in adolescence.
Well, you've mentioned a couple of interesting things there in terms of anxiety and depression. I've met many users who tell me that they use cannabis to try and manage the symptoms of anxiety and depression, and yet many times we're led to believe actually cannabis might be exacerbating or even causing those symptoms. What's the truth?
I think you're totally right there. I mean, the perception, often people do say they're using cannabis to make them feel relaxed and less anxious. That effect seems to be coming from the CBD part of the cannabis, but the high potency cannabis contains a lot of THC, tetrahydrocannabidiol, and that actually is anxiety provoking. And we have shown another study I've been involved in, another longitudinal study of young people in Bristol in the UK, and we published a study recently showing that young people who use high potency cannabis have a 3-fold increased risk of anxiety disorder, and this was this was still when they were in age 24, early 20s. They were meeting criteria for an anxiety disorder. So it definitely is not. The scientific evidence is showing that it's actually increasing anxiety and also increased rates of depression. Even recently, Stormzy, the rapper here in the UK, has come out by saying, I'm stopping using weed because it's making me more anxious and more depressed. And just leading on from that, Aaron, one issue I'm very concerned about is the issue of suicidality, because I don't think enough is being made of this link, but a recent study has it pulled together. There's not a lot of evidence on it, but the evidence that there is really, really worrying. And a recent, what we call a meta-analysis, where you pool together the results of studies, has shown a 3-fold increased risk of suicide. Both attempted suicide and suicidal thoughts and completed suicide in young people who are heavy cannabis users. This is extremely concerning.
We've talked today about the impacts on the young developing brain, on those perhaps who have a genetic predisposition towards schizophrenia. And there'll be those who want to use cannabis who say, well, if I'm not young and I don't have a history of that, then this drug is going to be basically harmless for me to use. It's only a problem for those 2 very special groups. Is it really true that it's harmless for the rest of the population to use?
The problem is, Aaron, cannabis is a drug that people start using early. So it's very hard to disentangle this. There are not, if you look at the epidemiology of it, there are very few people who start using in late adulthood. They've already started. That's just the kind of drug it is. So it's the other issue is about the genetic. Now, I suppose we're finding that perhaps the effects are less if you start using late and only use very, very occasionally. That's fine. But are you going to put young people at risk in order to have an occasional joint? This is the question I suppose people have to think about. We do have, I worry about young people's mental health a lot, and we must do all we can to protect them. If they are seeing adults using the drug, then of course they're going to use it too. And any amount of education isn't going to convince them that this drug is harmful because they see older people using it. The other issue I think that you mentioned, which is an interesting argument that's used, that only people at genetic risk for schizophrenia or psychosis will be affected. That actually is not the case. Okay, if you have a very strong family history, i.e. lots of your family members have been affected with psychotic disorder, of course you will be at increased risk of psychosis, and cannabis is very likely, or marijuana use will trigger that and will tip you over the edge. But if you hadn't used it, then you may not have developed it. So in that case, it's part of the cause of this. It's not the genetics as such. It's because you can't change that. This is something you can change. This is a risk factor you can eliminate from your life, and you reduce your chances of developing this illness. And in fact, we've been studying the genetics of schizophrenia for decades now. Now there is no gene for schizophrenia. There are hundreds of small genetic risk factors gathered together, and you can create a score. So we all have within us genes, small genes that can predispose us to schizophrenia. It's in some people they have more of a collection of these than others, and we call this a polygenic risk score. Now, interestingly, in both in the ALSPAC study, the UK study that I've been involved in, and also the Christchurch study in New Zealand, they've shown that even when you take account of it, you can measure an individual's polygenic risk score for schizophrenia. And even when you take account of that, cannabis will still increase the risk for psychosis. So it's not the total story, but definitely there's an interaction.
The drug is cannabis, and inside of our brain is that endocannabinoid system. I've heard users say, well, that must be proof that we're designed to take cannabis. I
know. I've heard that too. It doesn't make sense to me. I'm not an expert on receptors. I don't study them, but you could say the same about LSD or about cocaine. All these drugs work on receptors. We all have receptors in our brain. It doesn't mean that is a good thing to do.
We're talking about recreational cannabis in this country because medicinal is already legal, and yet, as you've mentioned already, sometimes the medicinal effect is present in those using a product that also has THC. What's your attitude towards medicinal marijuana? Are the CBD products safe, or is the jury still out on just how medicinally effective cannabis can be?
Yes, the field of what we call, I don't like the word medical cannabis. It's medicinal would be. They're very far from. It's very far from being a medicine in the way we describe it. It hasn't gone through all the testing and the randomized controlled trials and the proper evidence and the proper delivery systems, the control systems. It's bypassed. This product has bypassed all of that somehow. I don't understand how, but in Ireland we have a different situation. It's only recently been approved for 3 very specific conditions for which there is reasonable evidence. Now there's two forms of childhood epilepsy, rare childhood epilepsy, spasticity and multiple sclerosis, and then it's also approved for severe vomiting in patients with chemotherapy. Now, the evidence, the strongest evidence is probably for those two rare types of childhood epilepsy, that there seems to be some effect in a proportion of sufferers who have it, and it's a very distressing condition. But for other conditions, the evidence is just, it's not convincing. There's very few what we call placebo-controlled trials have been done, and this is where you compare to something that has no effect, but will account as a huge placebo effect in all medicines, where if people feel something is going to help them, then it is helping them, and that has to be taken account of, and this hasn't been done properly for any of these cannabis type products. I don't like the word medical marijuana because it's not medical. I suppose I also have some problems with the term recreational. I mean, recreational to me is something that, like surfing or skateboarding, or something that's nice and good for you and makes you feel good, and healthy activities, but it seems to have crept into the terminology in terms of, and it's again softening people's attitude towards cannabis. That how can this be harmful if we call it recreational?
I want to finish today by asking you to do something as a scientist you won't like at all. I want to ask you to look forward with no data, no evidence, just your hunches and your speculations. What do you see could be the future if cannabis is legalized and a generation of young people start using this high potency product? Many of them will get addicted. What does the future hold 10, 20, 30 years from now? Well,
Robin Murray, he was my PhD supervisor, and he's a wonderful man. He's Professor Sir Robin Murray now in the Institute of Psychiatry, and he has a lovely phrase. He said, that Canada and the United States they're carrying out an enormous pharmaceutical experiment on the brains of their young people. So we don't need a crystal ball. We look and see what's happening in states that have legalized cannabis. And, Colorado is one of the first states in the US, and that's the one where most of the data is coming out from. And to be honest, Aaron, things are not looking good. There doesn't appear to be any public health benefit. I'm talking from a health point of view. Now, I'm a doctor. I'm not a politician. But it's very hard to see any benefits from making this high potency product even more available, and the potency is just getting higher and higher, and it doesn't seem the black market hasn't gone away. The illegal market is still there. It's undercutting the legal market. The emergency department presentations with cannabis-related problems have tripled. The doctors are at their wits' end over there. The emergency medicine doctors. We have really worrying, as I mentioned before. I'm extremely concerned about the link with youth suicide, and they're finding that youth suicide has increased, and that in young people who have toxicology taken after committing suicide, you look at the blood, 30% of them have cannabis in their bloodstream, compared to, and 10% have alcohol, but 30% of cannabis on those tests. This is really stark and extremely worrying. I just would urge the people in New Zealand to look at where this has already happened and see, are there any benefits?
And you can't see any.
Well, it's just, people talk about revenue that will come from cannabis, but no one ever seems to factor in the public health costs of a young person developing psychosis and having this illness for the rest of their lives, or the cost of a suicide to a family, the cost of dropping out of college, the cost of being on social welfare. No one's doing these maths, and they're all talking about this tax revenue. And I think where people are trying to do it in Colorado, they're showing it definitely doesn't compensate for the public health costs of this substance.
Joining me today from SAM is Will Jones. Hi, Will.
Hey, Aaron. Thanks for having me.
It's good to have you with us. Tell us what brought you to this topic. Of all the things in life make your cause, why this one?
Honestly, because there were not a lot of people speaking out on this issue, especially from communities like mine, about the impact of legalization and commercialization. It's an issue that unfortunately has become very polarizing, and one where unfortunately also I don't think people give deep thought to the breadth of policy positions that are available for this issue. So often people get pushed in a category of either supporting legalization or arrest and incarceration. And honestly, I believe both of those are extremes when we're talking about marijuana policy, whether they're talking about commercialization or incarceration. And so really want to see solutions pushed forward that are between those two extremes. And that's a space where there's not a lot of people talking right now. It's something very personal to me because I have family members that have been impacted by marijuana use. And I also live in a community that has really been exploited by big tobacco in the liquor industries in the past. I tell people all the time, if I walk out the front door of my house in any direction, the first store that I'll get to is a liquor store. And if we go a little bit farther, I'll get to a convenience store, but it'll be so covered with advertisements for tobacco, liquor, and the lottery that you can't even see inside the windows of that store. So I don't want us to go down a path with marijuana policy that repeats the mistakes of the past.
Well, let's talk about some of those supposed benefits for vulnerable communities. Now, at this point, of course, American culture and Kiwi culture, in some levels, very different, but in others, we both see that, unfortunately, communities of color are overpopulated in our prison system, for instance, perhaps for different reasons. But certainly, those advocating for the law change here suggest that if cannabis were legal, that somehow this would address the issue of racial targeting by police. Now, that seems to me unlikely in that I would have thought the only thing that stops the racial targeting would be a change of heart and attitude in the police officer, and that I can't quite see how removing one thing that they can investigate is going to necessarily do that job. Do you think it's enough to change those terrible outcomes where certain communities feel like they are being targeted?
Yeah, and you're right. I agree with you on several things you said there. First, that the United States and New Zealand are different places. And so I haven't been there yet, but I'd love to. I was planning to before all of this coronavirus stuff happened. But at least as it pertains to the United States, and you could speak more specifically to how it is there, but where you mention it's an issue of the heart. That is so true. And especially in the United States, we're talking about a place where for years, centuries, discrimination and prejudice against people of color was enacted. And we've just begun to be seeing changes that have needed to happen for years in our country. And so the idea that legalizing and commercializing a product is going to deal with those systemic injustices and those systemic inequalities within our nation, I tell people I believe that's naive at best, if not outright appropriating issues of systemic injustice for personal gain and personal profit. And what I mean by that is that we can and should decriminalize, so remove criminal penalties for marijuana use. Someone should be arrested or sit in jail for smoking a joint. I don't think anybody wants to do that, frankly. And so if we're being serious that we're focusing on this for criminal justice reform and for social justice reasons, then that would be an avenue that we would explore, and we should explore, I believe, removing criminal penalties for personal possession and use. However, when we talk about commercializing, that allows a whole industry of advertisements, of stores, billboards, TV ads, magazine ads. All of that is what comes into play when we talk about legalizing and commercializing. And we know that system exploits vulnerable communities, disadvantaged communities, and impoverished communities. They have a history of doing that here in the U.S. As I mentioned earlier, the liquor and tobacco industries have done that. It's been in their documents that they targeted communities of color. Now they've invested billions of dollars in a new industry because everyone knows, for example, smoking cigarettes is bad for you. So they, like anybody, they don't want to lose money. They want to keep their business viable. But now they're looking at another product line, and it's marijuana, cannabis, whatever we want to call it, and that's looking very promising to them. And so I challenge people and I question people: why would these companies magically change their marketing practices just because they have a new product? And that's why I say it's really appropriating issues of systemic injustice and inequality to create revenue for themselves. Again, if we want to focus on criminal justice reform, let's focus on decriminalization, removing criminal penalties, and expungements for those who may have it on their record. When we talk about commercialization, that's a whole nother issue.
When we talk about commercialisation, the proposed law here in New Zealand wants to make some special allowance for Māori people to be able to be involved in that commercial market, and yet many Māori community leaders don't believe that that will happen, that those who are currently growing and selling, often through the gang system, are unlikely to become the legal sellers. And when I watch the documentaries that are being produced about the legalization of cannabis, I note that the owners of stores are typically white. They're very rarely people of color. It doesn't seem very often that a gang leader decides to go legal.
Yeah, I mean, I can only, again, speak to what I've seen happen here in the U.S., but definitely it's been primarily white males that have benefited from a monetary perspective from legalization here in the U.S. Even places where they said it was for social justice and they wanted to have equity initiatives and all these things, like Chicago, Illinois, where they legalized recently. When they started, there were no people of color that were in the industry, zero. And that's not unique to there. There have been other states that have tried it, and it's less than, or I should say over 80% of people in the industry in the U.S. are whites that are reaping the benefits of this. And in some states, it's as low as like 2%. Some states that have legalized, it's as low as 2% people of color that are in the industry. And so this idea that the revenue aspect of it is supposed to, what people say here in the U.S. is it's supposed to reinvest in communities harmed by the war on drugs. That's not something that's played out as of yet. And again, I would look at other industries and say that I have no reason to believe that that's magically going to change with cannabis. Again, we can look at the tobacco industry and the liquor industry, which are heavily taxed here in the U.S. I look at communities like mine, communities of color in major cities, and say, where is all the reinvestment that was supposed to have happened from these industries in our communities? Our communities are still underfunded in terms of education, healthcare, so many areas. If, taxing an addictive substance was going to substantively change our communities, I think we should have been able to see that by now, but it's not played out. In fact, what happens is, again, disadvantaged populations are preyed on by a commercial industry with predatory marketing practices, and they bear the brunt of unfortunately, substance use that turns into addiction for many people and has health consequences associated with it.
Yeah, it seems like this legalization is premised on a kind of a shaky ground. The idea being that this regulated market that will appear will somehow cause gangs and the black market just to throw their hands in the air and say, well, that's it. We'll give up growing and selling cannabis. We're done. You've got us. And yet it seems that what really happens, of course, is that once the new business has to deal with compliance costs, being able to have facilities, overheads, once they have to pay tax on the product and just the general goods and services tax, that the end product will end up being a lot more expensive than the black market variety. I mean, is it even true that in vulnerable communities that people will even go to these shops, or will they keep going to the black market like they always have?
I mean, there's, of course, some people that will, avail themselves of the stores, but what we've seen in places like Canada, in California, and other places that have tried that here in the U.S. is that often it is still cheaper on the black market to purchase your product. And it's specific to cartels, and multinational cartels that many people say, well, this is why we should legalize it, take it out of their hands. One reality that we have to think about is, first, that this has not been, their primary source of income for multinational cartels, it's been shown to be, between 15 to 25% of their revenue, depending on, which organization they're looking at. And those are rough estimates. But what are they replacing that with? And there's some indication from some government sources that they are replacing marijuana with harder drugs. So they've lost some revenue from selling marijuana. And again, like any business person, they're not like, well, we're just going to lose our revenue now. They're branching out into other areas. And so, again, it's kind of early to conclusively say that this is the case, but there is some indication that cartels are now running harder drugs, which may be related to some of the rising drug problems we're seeing here in the U.S., but they're selling those products now that they've lost some revenue from selling marijuana. So that's another aspect that we have to be aware of. But at any rate, as you say, cartels and whatnot, they're not going to all of a sudden change and become legal businesses because marijuana has become legalized. There's no indication that that has happened. And here in the U.S., states like California have actually seen an increase in black market activity since legalization. In fact, California called in the National Guard to help deal with some of the problems on federal land in national forests, where they were seeing these huge grows with pesticides and all these types of things that are contaminating the environment. So in some states, it's even been an increasingly worse problem since legalization.
Talk about the flow-on effects. Whilst we know that, for example, if you use cannabis for the next couple of hours, you might not be very likely to be violent. It does seem, though, that the flow-on effects in terms of things like poverty, when you've been using the family's money to purchase cannabis, that things like conflict and violence might happen at other times. And there are other flow-on effects to the children who are growing up in homes where money that's supposed to be used on food is being used on things like cannabis. I mean, what are the flow-on effects that happen in vulnerable communities?
Yeah, and I would say this doesn't just happen in vulnerable communities, but it probably impacts vulnerable communities the most. And that's because when you have less resources and you're spending it on, something like substance use, that's going to much more negatively impact a lower income family, and also a family that might not have as many other social resources to avail themselves of if their use slides into addiction. And I would say that with cannabis, those issues that you just mentioned, there's nothing unique per se about marijuana in this respect and how it can impact users when we're talking about drugs. It's cannabis use disorder is what it's called now, the category. And with any use disorder, whether we're talking about alcohol or some other drug or medications, what have you, it begins to infringe on normal, and this is what makes it a use disorder, but it infringes on normal activities that you would do, how you'd be around your family, how you prioritize your work or your education. It becomes something that becomes primary in your mind, and your focus is towards using and obtaining that substance. And the same thing can happen with cannabis. Some people say that it's not addictive, but that is not true. All the science and research shows that it can. The chances is 1 in 12. About, if you're an adult, 1 in 6 if you start in your teens. And so it's like many other drugs that many people slide into substance use disorder, and it has a negative impact on their lives. And as I mentioned earlier, where it's particularly damaging for vulnerable communities is that you don't have the infrastructure and the other resources to, if you lost your job, then to get another one, or if you got kicked out of school, then to get into another great school, because your social network is able to take care of those things. When you're in a lower income community, you don't have as many of those options available to you, so the consequences of substance use and disorder fall even heavier in these communities. And the other thing I would mention, and this is what really concerns me, is that you're in a lot denser housing and living when you're in a lower income community. A lot of people live in apartments, in high-rise apartments. And so for the individuals that choose to use, a a lot of times they're exposing a lot more other people to their use. And so a lot more people are getting the negative health impacts, whether it's from secondhand smoke or even children in the homes. That's another thing that I've seen firsthand as a first responder here in the US, where I go into the apartment complex, the hallways are filled with cannabis smoke, the apartments are filled with cannabis smoke, and there's all these kids crammed in these small apartments that are subjected to that. And we know all the science research shows that it is damaging to young brains when they're inhaling at a young age. And so that's another consequence that we have to be aware of.
Well, finally today, I want to talk about this false choice that you mentioned at the top of the interview, this choice that our only options are to throw people in jail or to let them all out of jail and say this is just a health issue and nothing more, as if there are no points sort of in between. Now, certainly when it comes to our referendum, as a nation, we're just simply being asked, effectively, is legalization better than prohibition? Because those are the only two options being put in front of us. Many people are asking us, well, are there third options? Are there other things that could be done that would be more effective? And that's a really great question.
Yeah, and our organization, Smart Approaches to Marijuana, that is what we talk about everywhere we go, that this false dichotomy is set up between incarceration and commercialization. Something a lot more reasonable, and I hope that we as a society would be interested in choosing reasonable options, would be something targeted specifically at removing criminal penalties for substance use with marijuana, so that, again, if someone has a joint, it's not going to throw them in jail and disrupt the rest of their lives. But there are health options for those that are that may have slid into addiction with their use, and that it's much more treated as a health issue than as either a criminal justice issue or an issue where addiction is exploited for profit. Again, those are extremes on the spectrum of policy options that we have available to us. And so that's what we encourage people that we believe that we should be exploring policy down this route. An example of a country that's done this, and, we don't recommend what they did, exactly, but a decent model that we refer to is Portugal, where, again, they do not have Philip Morris and alcohol companies, Heineken, Molson Coors. These are industries, by the way, that have invested in cannabis here in North America, but they're not selling products in stores. They decriminalize use, and they have a system that they set up for not just marijuana use, but substance use in general. And that's a much more reasonable approach than opening the floodgates to big tobacco companies, liquor companies, and other industries that want to exploit and create a new industry of addiction for profit.